And I think it would motivate them to look at this in a different way. With the whole idea of the studies that we always talk about lose some of their meaning. Even the idea of how diabetes develops, say, in All Hat, or some of the other hypertension studies, because it was not there long enough to afflict the patients. The primary care physicians are confused about this. And then Verdecchia publishes a paper that looks at people for 15 years and was published a year ago, and looks at the impact of new onset diabetes as being almost equivalent to long-standing diabetes. And I think what was mentioned before, the idea of the metabolic syndrome and diabetes making cancer look like a picnic is something that has to be encouraged, because as has been said, cancer comes and it messes with you badly, and if you're lucky enough to survive, you'll have scars, but you may live after a year. Reality is, though, that cancer and or diabetes or metabolic syndrome is just getting warmed up after a couple of years. And by the time the disease gets rolling, you no longer have the option of putting the brakes on. And at that point, all you can do is try to slow it, but you certainly can't do anything else. And the autopsy studies, some of the data that came out of Cleveland on looking at coronaries via IVUS in people that had died, and 85% of people over the age of 50 had significant plaque in their coronaries. That's a message that primary prevention in this country is abysmal. Right, exactly right. And these are people that had no antecedent history. And those kind of studies are the ones that are motivating, along with the homunculus that you guys used in one of your earlier studies about the vulnerable patient not being the Scandinavian girl of age 20 with a cholesterol of 250. I think this is where the motivation has to be. And looking for long-term risk may motivate the people that treat people who develop long-term risk, who are the biggest number of physicians in the country, which is primary care.
While I'm just taking this to Erling, I want to quickly comment. We are not creating a whole new textbook of preventive cardiology. We are trying to add a small chapter which we believe can fill in the gap that largely exists. And we think that can bring a very high added value.